Right, with a population of more than 170 million Nigerians, one would expect that healthcare delivery in the country would be at its best to meet the health demands of the people, but it is not the case.
From dilapidated infrastructure to corruption in government and unfavorable health policies, Nigeria's healthcare system leaves much to be desired. TVC Breakfast takes a look at the state of government hospitals.
Decay in public infrastructure and institutions is mostly attributed to lack of maintenance culture and lack of resources. On the average, this hospital looks well maintained, but it is not completely immune to the decay in the health sector.
Where you used to have 10 registrars, now you have 3. Where you used to have about maybe 20 SR, you have only 1. So there's a limited thing they can do because there is acute shortage of manpower.
The health sector has witnessed a series of industrial agitations occasioned by non-payment of salaries and allowances.
But when they get to the hospital and things that are necessary for emergencies to take care of them are not there, doctors won't kill themselves.
Apart from the personnel challenge and industrial disharmony, the Nigeria Medical Association believes the system is also challenged, especially in the areas of drugs and modern medical facilities.
We need a lot of funds to augment and upgrade our facility and also, by extension, our practice.
For now, patients can only wish the hospitals are adequately equipped.
Over the years in Nigeria, due to massive corruption in governance at all levels, what we have everywhere are purely equipped and staffed hospitals. The sector is also characterized by decayed infrastructure and abandoned projects here and there. Asaba, the Delta State capital for instance, has no standard state government-owned hospital because of policy somersaults. The small hospital in neighboring Ukwe community that is serving the highly populated state capital is nothing to write home about. The saving grace that residents of Asaba have now to meet their health needs is the Federal Medical Center. The hospital buildings, environment and facilities met reasonable standards. But one of the doctors says the personnel and facilities in the hospital are overstressed.
I'm fairly enough hands, but the Oliver twist, we still want more because actually the work pressure is quite much. So if we can get more consultants, that's okay.
This is supposed to be a primary healthcare center in Ungwamboro, a suburb of Kaduna.
All right, sorry, we lost signal on that report, but certainly we'll try to put it together and let you know, because we're taking you to Kaduna to see the state of medical services there and even the state of the hospitals themselves. We started from Lagos, took you to Asaba, and then to Kaduna. There are other reports from other parts of the country. Even parts of Abuja is not left out. You would say that it is the Federal Capital Territory, but
yes,
then
you
go there,
something
you expect
close
some
to
level
excellent.
But unfortunately, it's not the same. All right, with us in the studio is the medical doctor, Dokun Adedeji, and the public relations officer of the Nigeria Medical Association, Abuja. He is joining us from Abuja studio, Dr. Roland Aibovo. He's there in Abuja studio. However, Dr. Adedeji, it's good to have you on the program right now.
Thank you very much. Always nice to be
now,
here.
you are on ground and you are in the system. Can you give us a picture, apart from the report we just played? Tell us how bad is the state of hospitals right now?
Listen, let me be very honest with you. It is terrible. How people manage to attend these hospitals and stay there even on admission, for me, is unbelievable. Incident, you know, and it's national. It's not as if one place is better than the other. If you go to the hinterland, you will go to Luth, you'll be surprised at what you will see. Lasuth, as much as they want to try to modernize it, the space constraint is one thing. Treatment of patients. Look, honestly, how doctors practice in these hospitals before Dorme. I walked away from public hospital because I couldn't stand it. I mean, you get there. You know, the painful thing for me is that doctors have not directed attention more to it. when they go on strike or when we go on strike, what people see is money. Money for doctors are benefits. But I think, and I've said to my colleagues, one of the things that like you're doing, that they should do, NMA in particular, is form a group and get people to visit hospitals when there's no strike. Let them see the state of the hospital. Let them themselves understand. And so when you say, look, we want to go on strike, people not say, oh, it's because of money, it's because of this and that. The state of the hospital is abysmal. That is how to simply put it. And it comes from many years of neglect and many years of nonchalance. I asked the Nigerians themselves, what is our expectation of a proper medical center? We don't have. So when we give anything, we take it. How in God's name will you go to a hospital and there's no water? There's no light. I remember when I was in Ife, we operated a woman with torch. And I'm not joking. It was we needed to do a section. There was no light and there was no diesel. So we had to get the lanterns and everything to do the operation. I remember when I was in Cadbury, I needed to operate a staff of mine in a Ikeja. There was no, I promised them that I would give diesel. And I said they shouldn't even use government light, use diesel throughout. And I left them like 2 drums. If the nation understands the primary or the primacy of health, we will do much better. Incidentally, I happen to have worked with Shopi. Believe me, it was a good thing, but it was terribly
poorly executed?
Poorly, totally, because of corruption. Look, I still have on my laps, because I was zonal coordinator for Southwest, I still have on my laptop hospitals, health centers, permanent that you want people to come.
You know, there was a time during those different coups, you know, in the past when you hear the person making the announcement say that Nigerian hospitals have been turned to mere consultation
clinics, and then
clinics, and that Nigerian hospitals have actually been described as death chambers. And I'm just wondering, I mean, is this really not an extreme description of the state of affairs when it comes to our health, you know, government hospitals?
Believe me, I don't think it is. It is not extreme, that is the reality. And I'm praying that you talk to the PRO of NMA. These are the issues we must be highlighting. Even if we're going to talk about money, let it be the bottom part of it. Get people, believe me, maybe now that you're doing this, get a segment of the press, print and media and whatever, visit our hospitals and ask yourself whether these are hospitals. Even the morgues now are not operated by hospitals, they're operated by private people. Because if they're operated by government, you'll be ashamed.
Yes.
We'll come back to have more.
Of course, just to remind you, of course, Dr. Agbovo is still there in Abuja. We'll come to you right after we shed some more light on this. Since independence, Nigeria's health sector, like other sectors of the country's economy, has had its good and bad times. Some analysts say the national health indices are uninspiring. The private health sector is weak, government health facilities are in decay, and the policies not consistent.
Now, over the years, Nigerians have remained hopeful of improved healthcare delivery. But before we go deep into all of these, let's examine what obtained in the early days before the introduction of hospitals. Now, we had traditional healing and medical practices in the pre-colonial era, included herbalists, divine healers, midwives, spiritualists, bone setters, mental health therapies at that level, and some form of surgeons, if I might put it that way. But with the Western health system, they were relegated to the background and gradually sent to the law of extinction.
Now, today, that same Western health system is not getting the desired measure of development. Even though hospitals cannot be brushed aside, but many Nigerians are already abandoning Nigerian hospitals for treatment abroad because of the decay in government hospitals. Analysts say even the policymakers in the health sector don't trust the system.
Now, records have it that Nigerians spend about 250 billion naira annually on medical tourism. That's to India, Dubai, London and other places. But this represents about 300% increase from the 78 billion naira earlier put forward by the Nigerian Medical Association in 2012.
The NMA also said that India rakes in well over 50% of this money from Nigerians annually. More than 5,000 Nigerians traveled to India, with each of them spending between $20,000 and $40,000 on the average. India was also projected to have raked in a whopping $2 billion from a global medical tourism valued at $20 billion in 2012. Investigations also revealed that over 40,000 Nigerians obtained visas from Indian embassy that year alone. And so that explains the effect of the decay in Nigeria's health sector.
Yeah.
Let's bring in Dr. Agbovo. Good morning to you once again, Dr. Agbovo, right there in Abuja studio. Now, these are very troubling statistics of what it's costing Nigeria to actually go on medical tourism, whether it's India and all the rest of them. What do you think has really brought us to this pass where, we now rely mostly, many Nigerians especially, the less privileged.
Yeah.
Let's bring in Dr. Agbovo. Good morning to you once again, Dr. Agbovo, right there in Abuja studio. Now, these are very troubling statistics of what it's costing Nigeria to actually go on medical tourism, whether it's India and all the rest of them. What do you think has really brought us to this pass where, we now rely mostly, many Nigerians especially, the less privileged, actually, like, we read earlier, have to rely on faith healers, herbalists, and all of that, who tend to, complicate matters.
Hello, can you hear me?
Yes, Dr. Agbovo.
We can hear you.
Okay, so Dr. Agbovo, let me just put this very succinctly. What do you think is responsible for the state of our health sector right now?
Okay, thank you very much. Okay, thank you very much. Well, the state of our health sector at the moment is not really something that is for us to be proud about as doctors. And it's actually a combination of so many factors, ranging from the government and even the practitioners and the populace, as it were. And we, as doctors or health professionals, we have strived within the possible opportunities or what is available to us to practice, to actually do what is necessary, at least to provide effective and affordable health for our people. But we all know that it's not really what we will be proud of, even though we strive to give the best to our people. That is the situation at the moment.
All right, Dr. Agbovo, you are in the Federal Capital Territory. Those who are not in Abuja feel that Abuja is like it's like the heaven on earth. Can you give us a picture of how the state of health in Abuja precisely? Are the residents in Abuja happy that they have what it takes, the right standard of medical care and medical services in there?
Yeah, well, if you ask me, I will tell you yes, because apart from, I will give kudos to the government, the Federal Capital Territory Administration, and even to the federal government, especially for, we have more of health facilities that are actually giving their best, like have the National Hospital, they have the Teaching Hospital in Gwagwalada, and all the Federal Capital Territory Administration hospitals, which I practice in one. We strive within our best to give the best of care. And apart from that, you can also agree with me that there are a lot of other private facilities that are actually springing up in Abuja and are doing what we expect, the cutting-edge practice to give to our people. But one thing you should also know is that even with the populace that we provide care for, they also have the choice, or they have choices to make with where to go to, depending on what they can afford anyway. But generally, I think the healthcare services in Abuja is good compared to other states in the country.
All right, that's Dr. Agbovo's take on the healthcare facilities in Abuja, but you can hardly say the same thing for other parts of the country. Lagos, yes, indeed. Every time, Lagos seems to blaze the trail when it comes to improving whichever sector of the economy you're talking about. But it's still really not where it's supposed to be. You now have something that is evolving now, where health care is becoming a class-based thing. It's either you have money, you die, you live, and if you don't,
You die.
well, God help you.
You're right. You know, as Dr. Agbowo said, this is a multifaceted problem that needs to be tackled very fundamentally. But what we do in Nigeria is cosmetics. Do this, and then we dance away. Or build one hospital and paint it very well. The thing, what about the personnel? What about the infrastructure that is required to deliver? I mean, if you look at why people go abroad is not simply because of the aesthetics, but because of the factors of the way the hospitals operate and what they offer. The thing is, how many Nigerians, if you look in the bracket of the rich and the poor, the rich in Nigeria, let's say about 10%, and then you provide for them fantastic funds. What about the man who lives in my village? Can he come to Luz when already Luz has a long list of people to operate before they operate anybody from outside Luz? The thing is, which was the intention of Shopee, was to increase the number of the primary health care centers, because that is where people go. You see, the thing that we're doing in Nigeria is, somebody takes malaria to Luz. It's a bloody waste of time of doctors and Luz. Malaria and other things should be handled in the primary health sector. So the thing that we must begin to do is develop the primary health sector. There are a lot of people can go there for immunization. They can go there for small, little cases of ill health. And then you graduate to general hospital, to cottage hospital, and then to teaching hospital. Teaching hospital should be tertiary and be doing things like cancer and research and development. But what do we have? They see every kind of patient. If you have a wound, you go to Luz, for crying out loud. So unless we begin to settle down, to look at fundamental indices and what needs to be done, we'll be wasting our time. Doctors need to do a lot more to get people involved, to get people educated about the abysmal status of our health facilities. If you don't do that, if people only see doctors only when there is strike, then the thing is only for money. But go to our hospitals, you go surreptitiously and see. Even the ones in Abuja. Abuja, you will see the big national hospital and private hospitals. The lady in Wuse, the lady in Otakpo, can she go there?
All right, let's bring in Dr. Agbowo here. Now, you're very aware of how Nigerians travel abroad, medical tourism, especially to India. India has been a very focal destination for Nigerians. India is also a developing country like Nigeria. They share a lot of characteristics generally. What is India doing different, or what have they done differently that Nigeria isn't doing when it comes to medical services and medical care?
All right. Well, like you said, India is a developing country. I agree with you. But one thing you should also know that before India got to where they are today, there have been government involvement in the medical practice. They have had government support to set up our health system, which we are running to today. But let me make this clear that Nigerians going to India today is not really at most of those services they go to India to see that we cannot provide it. No, we in the medical profession, we know what is going on. Many people now who are seeing medical tourism as a kind of business, they want to, any little thing, send in their patient because they have a contact with people from India that will give them kickbacks and everything. But if you actually, yes, we have some situations where we have to send people outside because we don't have the facilities to cater for those facilities, for those to get those services to our people. But the government actually invested in their health system, and that is why people are running to India today. But another thing is that even while on several occasions we try to bring to the notice of the government that you need to invest in health. You know, every year in, year out, Nigeria, who actually is a signatory to the Abuja Declaration for the minimum of 15% budget for health, has never achieved up to that about 15% budget for health. Well, if the budgetary provision for health is abysmal, well, you know what happens thereafter, because you won't really get what is expected from such services. And so Nigeria is lagging behind, even though in comparison with India, say developing nation, but they have put set a goal for themselves that they need to achieve this, and the government has provided funds for them. So, but we can't say same thing for Nigeria, and that's why I'm still lagging behind.
Now, a Nigerian senator recently, actually recommended that there should be some kind of legislation to stop public officials from seeking, health service abroad. Should that be the way to go? Will that help in turning around our health sector? And in addition, beyond, government, relying on government alone to provide, good health services, it is Nigerians that go abroad, spend so much money, to get this health services abroad. Should they be thinking about setting up some kind of foundation or the other, that can actually be there for them to use later when the need arises?
All right. Well, government proposing a bill that people should not go outside for medical treatment. Well, for me, every individual, every Nigerian, you have the right to procure healthcare services anywhere in the world. If I'm
talking about public officials. Dr. Igovo, if you heard me correctly, I'm talking about public officials themselves, whether it is the local government chairman, governor, deputy, president, whoever, senator, that they cannot go abroad to seek medical help.
Yeah, if they can, they're not going abroad. I'm going there, not going abroad. I'm using public funds to go abroad for treatment. Because if they patronize the health services in this country, at least they actually boost the morale that yes, we can handle provide services to our people. The situation whereby the public officers are very little time even to do medical checkup in general of the country, they don't even have confidence in the system itself. And if the follower sees that the leader cannot afford healthcare or cannot access healthcare in the also country that goes abroad, everybody wants to go abroad too. And that's just the problem. I think they should improve the confidence in our health system by patronizing the health care services in these facilities in the country. That will actually boost the confidence. And also coming to the issue of government not providing healthcare alone. Well, governments can't do it alone. I agree with you, but they have a major role to play. Because if, like what we have advocated on several occasions, is the issue of providing more like a fund or a pool of fund where people who are practitioners who want to go into healthcare business can go there and access. The situation whereby you don't have something like that, you want to go to regular banks to collect facility for you to set up with the interest rates hitting the roof, well, you know that it's not something anybody wants to be proud of. But what we are advocating is that the government should provide a pool or a fund where they can actually go and access and provide it. And people are doing it in Abuja. I have one, two, three persons or practitioners to say that have actually done this. But how many compared to our population that is rising every day? So I think the government actually has a role to play.
All right, Dr. Roland Aigbovo, Public Relations Officer of the Nigeria Medical Association, Abuja. Thanks for talking to us on TVC Breakfast. All right, now, Dr. Adedeji, we see hospitals sometimes, 2, 3, 4, 5-story buildings. When it comes to the structure of a hospital, how favorable are such kind of high-rise building as a hospital for people who are not feeling well?
You see, it speaks to the way we operate policy in Nigeria. In America, for instance, we want to set up, if there are guidelines on what you need to do. Many of our hospitals don't have facilities for the physically challenged, someone that is in coma or someone that needs to be moved. Those are fundamental issues. That's why I said to you, look, what we like to do in Nigeria is just come and then look at things, and then we do, and then we're satisfied. That is not it. We have to fundamentally look at the issues facing us, and then we then decide what are the things that are appropriate to deal with it, and then it's become systematic, and then it's documented. And if you don't get certified to practice it. But what we do here is, in order to respond to noise, something that we just do something, everybody keeps quiet and we walk away. We need to do things different.
Dr. Dokun Adedeji, just hold on for us. Okay, this is where we really have to end it. We still have so many issues to look at this morning on the show. We'll take a quick commercial break, and when we come back, of course, Kemi will be here for the news update, and we'll continue the discussion. Stay with us.